sure you already know that we're waiting on a quorum. One more person. Now that we have quorum, we don't have a lot of bills that have come over from the Senate. We will be having other meetings, but it's been sort of a slow a little bit over there with health bills. Not so many. This year it's a little unusual. So, and I don't think we sent as many. So we will be having other meetings, but I'll call this meeting of the Health and Human Services Committee together in order, and I will call on Senator Kay Kirkpatrick for SB 16. You've got the floor, Senator.
Thank you, Madam Chair, members of the committee. I'd like to walk you through Senate Bill 16, the Interstate Medical Licensure Compact Bill. The bill would make Georgia the 25th state participating in the compact. The goal of the bill is to improve access and to protect the public. The bill does the following. It provides for an expedited licensing process for doctors coming into the state with a clean record. Wait times are currently long in our state because our composite medical board has to do primary source verification of each piece of information in the application. If someone qualifies for an expedited pathway coming from another compact state, Georgia would already have access to the information verified by their primary licensing state. Doctors who do not qualify for the expedited process, for example, if they've had their DEA license suspended, would go through the normal licensure process. The bill allows data to be shared with other compact states, including any disciplinary action. And the bill adds a background check provision, including fingerprints. This will allow Georgia to screen doctors with potential problems who are choosing Georgia as their primary state. Most hospitals and many large medical groups, including the one where I worked at Resurgence Orthopedics, already require background checks to protect the public. The fees are paid by the applicant. The bill would help with getting qualified doctors through the licensing process more quickly and into practice, and would help our state as we develop telemedicine programs. The language in pages 4 through 20, starting with section 4, is compact language and cannot be changed. I feel that this bill improves patient safety, streamlines our licensing process, and improves access to care. It passed the Senate unanimously and is supported by the Composite State Medical Board. I'm happy to answer questions, and I would ask for your favorable consideration.
Okay, thank you very much. Questions for the senator? I think we're having to take a minute. Okay. Well, I'll start with one. So if they have had a disciplinary action, the states will share that information.
Absolutely.
What about private orders?
I think they share any disciplinary information.
Okay. Do the physicians who get the compact license, do they have to meet or exceed what we consider qualifies a doctor to practice in Georgia?
They actually would exceed that because they would have to have a completely clean record before they could even qualify for the program.
Okay. We've got a third one. Does it require that if they decide to stay in Georgia permanently, does it require them to get a reapply and get a Georgia medical license?
This would be a Georgia medical license. They would choose a primary state, and if Georgia's their primary state, they would go through our normal renewal process.
Okay, but what happens if Indiana is their primary? They're coming in from Indiana and coming in from somewhere else, and Indiana is their primary state. Would they have to, if they decided to live in Georgia, not just practice temporarily here, would they have to get a Georgia license?
Yes.
Okay. And the board would have to, and does the board have to keep up with who's coming into our state?
Yes.
Yes, so they would know, okay. All right. Representative Henson.
Thank you, Madam Chair. I believe you've answered this, but I just want to confirm it. In the past, there's certain requirements that you could take your boards, and you had within 10 years oftentimes to be able to go to other states. This is regardless of time frame, is it? That, I mean, if you graduate, take your boards in Indiana, and 30 years later want to move to Georgia.
Most of the boards have time-limited certificates now, and so you'd have to maintain current certification. People who are grandfathered, so they came in before the time limitations on their certificates, would still be grandfathered. But if you have a time limit on your certificate, that would be relevant to this.
And then I have a second question.
Okay, go ahead.
That's all right. With regard to physicians that are in semi-retirement, how would that work? Or have been some retired, can they then come into Georgia and decide to begin practicing again?
If they meet all the criteria, they would. And they would, if they have a clean record, they would be eligible for the expedited process.
Thank you.
Other questions for the senator? Okay. Does our board have the nursing board has a thing, if you haven't practiced if you do away with your license or go to a, sort of a temporary or a halfway license where you don't practice anymore. If you want to come back and practice, there's a requirement of taking so many hours in clinical if you're out for a period of time. That's, I think, is what the Representative Henson was asking. Is there something like that written into the compact as far as how long they've been out?
I don't believe there is, but we do have the ongoing continuing medical education requirement as a condition of licensure, whether you're retired or actively practicing, and it's 40 hours every 2 years.
Okay, whether you're retired or actively
Yes.
practicing. Okay, thank you. Representative Hutchinson.
Thank you. Did we do something similar for psychiatrists? Or are we working on something similar for psychiatrists? Do we have the same thing?
Well, the psychiatrist would fall under this. It would be the psychologist. And I believe we passed that out, or did it pass out? Did it pass off the floor? The one for Dave Belton? Did it go over to the Senate? I think we sent one over by Representative Belton.
Okay. Is this similar or have any big, huge differences between that one?
Well, actually, some of the boards are different. Believe it or not, we had added to our nursing board that they had to meet our standards or exceed them, and that is having to be removed. So, and I know that one of the ones we had said that we could require whoever it is to take another exam besides the one major exam, that we could require 2 exams. So I think they're all written a little bit differently, but basically there's a national board that screens the applicants and decides if they meet a certain type of criteria. So basically the structure is similar, if not exactly.
I know for social workers, marriage and family therapists and licensed clinical social workers, we have absolutely no reciprocity at all. So if somebody comes in from California who has to take, to get a social work license in California, it's a 2-day exam, 1 day full written, 1 day full oral. But they still would have to come to Georgia and take a test. So I was just wondering, I know we did that for, I know we talked about doing it for psychiatrists and for telemed.
Right.
And if this is similar,
Well, the psychiatrist would fall under this one.
That's right.
okay.
Okay, so for psychiatrists, they would get one through the medical compact. Psychology passed? Yeah. Over in the Senate? No, not yet. No, not yet. Okay, the psychologist one went across. It hadn't passed the Senate yet. Okay. Huh? House Bill 26, if you want to follow it. She's not listening. Huh? Representative Henson.
Thank you. Apologize, I haven't read this bill in advance. Does this also include dentists?
No, ma'am, it's just physicians. There are lots of compact bills that are floating around. This one is very specific to the Composite State Medical Board.
Thank you.
Any other questions? Okay, go ahead.
Thanks for bringing the bill. Do you have a House sponsor?
Yes, Representative Silcox has agreed to carry the bill.
Okay. All right. Any other questions? I think one of the, and I would applaud whoever's making the medical compact, because the nursing board is also saying they don't have to share if there's been any disciplinary actions with the other states, which I find pretty appalling. So unless it's changed, which I don't think it has, we're not guaranteed that we are getting nurses who have had some kind of serious action taken against them. We could be getting them in the state of Georgia. So that is a big concern of mine. Okay. Representative Newton.
Madam Chair, at the appropriate time, I'd like to make a motion.
Okay, I don't see any. Are there any further questions? All right, this is the appropriate time.
Motion do pass. Thank you, Senator.
Okay, I have a motion to pass in a second. Is there any further discussion? All right, seeing no further discussion, everyone in favor of the passage of Senate Bill 16, say aye. Aye. Everyone opposed, no. Okay, looks like the ayes have it. Congratulations, Senator. And this may go on the record as one of the shortest ever Health and Human Services Committee that we have ever had, and so hopefully it'll make up for some of the long ones. You're adjourned.